I was diagnosed with Graves' disease in 2008, and I've remained in remission since 2009. And in this presentation, I'll discuss some of the things I've done over the years to maintain a state of wellness. So let's start with what I've been doing from a food standpoint. So overall, I've been following a modified paleo diet. I try to stick with eating whole, healthy foods. I do eat meat. I eat eggs, some fish. Can't say I eat a lot of fish. Plenty of vegetables, some fruit. Do eat nuts and seeds. I do have some dark chocolate. And I'm a smoothie person. So I do eat vegetables outside of smoothies, but I also include a good amount of vegetables in my smoothies and have a smoothie usually every day. Sometimes I might go a day without them. In the past, I used to have a few smoothies a day or make a large smoothie and split it up. And now usually I just will have it in a single serving, and I'll add a number of different vegetables, usually anywhere from 4 to 7 different vegetables, a little bit of fruit, usually some berries, like half a cup of berries, sometimes just a quarter of a cup. But anyway, berries. And then I will add some protein in there, some collagen, some protein powder, either hydrolyzed beef protein or a good quality pea protein. And so again, smoothies, gluten and dairy free for the most part. Again, every now and then I'll joke around and I'll say that I'll eat pizza every now and then, and it's usually cauliflower crust pizza, but it's not a dairy free pizza. And again, that is true. when I have pizza, it's almost never. I probably should say never, not almost never, but never having the vegan cheese. So if I have a pizza, it usually is the mozzarella cheese. And as far as gluten free, so again, I've been in remission as of recording this. It's been just about 15 years. And I can say that I haven't had any gluten exposure since then. Sometimes when it happens, it's accidental, like cross-contamination, but there's also been some intentional exposures as well. So I'm definitely not perfect in that area. I mean, I don't have celiac disease. I don't think I have a celiac gluten sensitivity, but again, that doesn't mean gluten doesn't have consequences. I know it affects permeability of the gut. It's inflammatory. So again, for the most part, I avoid gluten, but I can't say that it's been 100%. Grain-free, can't say I've been grain-free 100%. Sometimes I'll have some rice. Sometimes I'll have some quinoa. So when I'm eating grains, usually it's gluten-free grains. And I don't eat a lot of grains. I'm not a big grain person, but I'd be lying if I told you I never ate grains. How about refined foods and sugars? So refined foods and sugars, obviously, I try to minimize exposure to refined foods and sugars. Again, I can't say that I eat 100% whole foods and never eat anything out of a package. And when it is out of a package, usually it is healthier. Again, it's still not as healthy as a whole food. But like I said, I'm not perfect, and I'm purposely telling you this because I don't want anybody to think that they need to be perfect, especially when it comes to the diet that they follow, the food that they eat when maintaining a state of wellness. I eat, I'd say 80-90% of the time, I eat whole, healthy, organic foods, but it's not perfect. So again, you don't necessarily have to be perfect when in remission. Now, while healing, it's a different story. While healing, many people do need to be a lot more strict. Healthy oils. So I use mostly coconut oil, olive oil, avocado oil, and protein is important. So getting sufficient protein. So I recommend getting at least 75% of your ideal body weight in grams of protein. So for example, if you weigh 100, or let's say your ideal weight is 120 pounds, you would want to get at least 90 grams of protein per day. Some will say 1 gram per pound, which would mean in this situation, in this example, 120 grams of protein. Again, there's a lot of debate when it comes to that. In most cases, it's not going to hurt to do that, especially if you don't have any kidney issues or anything like that. But yeah, again, I strive for about 75% of protein. And again, does that mean just because I do it, it's right? No, that doesn't mean that's the case. But I've had people do that over the year. Honestly, I used to eat less protein, and again, I think though, as we get older and want to maintain healthy muscle mass, that making sure to get enough protein is important. But regardless of the age, I think getting, like I said, 75% I think is a good number. If you get a little bit more, maybe a little bit less, that's okay. How about the water I drink? So I drink mostly reverse osmosis, although I do drink some Mountain Valley Springs out of a glass bottle. Somewhat concerned about reverse osmosis taking out the minerals. I'm more concerned about the toxins. I mean, you could add minerals back to the water if you want, but most of these other water filtration methods do not take out enough toxins, enough toxicants. So that's why I like reverse osmosis. And again, drinking good quality spring water out of a glass bottle is that's also an option too. And again, there are other filters. I'm not saying you have to drink out of reverse osmosis. I know there are other water filters, but that's what I choose. And green tea, I usually have a cup of green tea every morning, and usually 1 or 2 cups of herbal tea. And then how about snacks? So people want to know about snack. What can I eat in between meals? I don't eat a lot of snacks, but sometimes I want a snack. Sometimes I'm in a mood for the snack, and usually it would be nuts and seeds. Sometimes it might be a coconut yogurt. So and maybe a little bit a square of dark chocolate. So yeah, I mean, again, I can't say I never desire a snack. And yeah, so those are some of the snacks. And overall, so that's what I wanted to cover with the food. I think I covered most of the more important things that I eat on a regular basis. I mean, I guess one question some people might wonder is if I incorporate intermittent fasting. And I do to some extent. I'm not an extreme. I don't do that to extreme measures. So I mean, definitely go at least 12, 14 hours in between meals. I usually stop eating at 7 at night, and rarely am I eating 7 the next morning. Usually it's more like 8, 9. So it's probably closer to 13, 14 hours. But there are times I'll go 16 hours, maybe a little bit more. The concern with some people is that they only have a 4 hour or a 6 hour eating window, and they're not getting enough nutrients, not getting enough protein. So I don't think everybody needs to incorporate intermittent fasting. But on the other hand, I'm not a big fan of eating right before going to bed, let's say 9, 10 o'clock. And then if you eat first thing in the morning, then you might only have like 7 or 8 hours. I mean, hopefully at least 8 hours. If you're go to bed at 10, hopefully you're in bed for 7.5, 8 hours. But still, 8 hours to me isn't a whole lot. I'd say minimum 10, probably 12 hours. But again, this is about what I've been doing. And the intermittent fasting's been over the last few years. Like I can't say I've been incorporating intermittent fasting since being in remission in 2009. So let's talk about stress, because stress was definitely a big factor in the development of my Graves' disease condition. And when I work with other people who have Graves as well as Hashimoto's, even non-autoimmune thyroid conditions, stress is a big factor. So I did adrenal testing, and that's how I knew that stress had a negative impact on my health. I mean, I was in denial, so I needed to see that saliva test at the time. So since then, I have blocked out time for stress management on a pretty much on a daily basis. I can't say I never skip a day, but I'm pretty good about taking the time to block out time for stress management. And again, sometimes it might only be 5 minutes. Other times it might be 15, 20 minutes. Again, I can't say I'm one that blocks out 45 minutes, an hour for stress management. I mean, if you do that, that's great. But I think the most important thing is getting into a routine first, and then doing a minimum of 5 minutes per day. And then some days that's might be all that you do. Other days you might spend more time, maybe even like 30 minutes, maybe 45 minutes, an hour. Again, that's something I don't do, but it doesn't mean that you can't do it. And as far as what do I do for stress management, sometimes it's just deep breathing. I do like the Inner Balance from HeartMath, HeartMath.com or .org. There's the 2 different websites, but associated with the same company. And that's a type of biofeedback, and really incorporating deep breathing meditation, but using the device for feedback. So that's what I use. Most of my patients, I would say, just use some type of mind-body medicine like deep breathing, meditation. Some use apps. There's a lot of neat apps out there like the Calm app and Headspace. So, but either way, you definitely want to block out time for stress management. I think many people overestimate their stress handling skills while minimizing, like, again, the stress levels. There's only so much you can do for the stress levels, but some people, just like myself years ago when I dealt with Graves, I thought I was doing a good job just naturally of handling the stress, but that wasn't the case, and that's true for a lot of people. Let's talk about exercise. So prior to my Graves' disease diagnosis, I was an avid exerciser, and was exercising as I record this. I'm in my 50s, and I've been exercising since I was in my late teens, and really regularly, I'd say, since undergrad, college, just not really missing a workout unless if I had an injury. The problem is when I dealt with Graves, or prior to dealing with prior to being diagnosed with Graves, I was overtraining. I was exercising too hard, which was also a stressor. So it wasn't just emotional stressors that I dealt with at the time. It was also the overtraining. So I'm real cautious about not doing that. I do resistance exercise 3-4 times a week for about an hour. And so that's something, I've always done weightlifting, always done resistance exercise. The one thing that's changed over the last few years is I've gone heavier, not to the point where I'm bodybuilding or anything like that, but definitely what the research does show that you want to challenge yourself. It doesn't mean most of my patients are women, and many women aren't looking to build muscle, like become bodybuilders, but it's very difficult to do that. So just if you lift heavy, it doesn't mean that you're going to be bulking up. So, and I do that just for the muscle mass, to increase muscle mass. So it's something I don't have to worry about as I get into my 60s, 70s, hopefully 70s and 80s. You never know what life's going to bring, but yeah, so resistance exercise. I do some high intensity interval training. Again, I'm cautious because I did overtrain in the past. Usually do it on a stationary bike once or twice a week. I know some will say do it 3 or 4 times a week, and maybe I should, but I only do it once or twice a week. I do a lot of walking, either go outside. Also have a treadmill desk, so I'll walk in a treadmill desk. I'm not on the treadmill desk as I record this, but I'll spend some time on the treadmill desk doing work. And yeah, so that's movement, again, regular movement's important, and so that really is what I do from an exercise standpoint. Let's talk about muscle mass, bone density maintenance, which kind of ties into exercise because exercise is important for that. I also mentioned sufficient protein. So sufficient protein, again, the weight bearing exercise 3 to 4 times per week. Vitamin D, having healthy vitamin D levels, at least 50 or greater. And I look at 25 OH or 25 hydroxy vitamin D when I do vitamin D testing. And you always want to make sure to take vitamin K2 because K2 helps to guide the calcium into the bone. Otherwise, it could deposit in some of the soft tissues, such as the arteries. And then as far as calcium, I'm consuming mostly non-dairy sources of calcium. Again, when I have the pizza with the mozzarella cheese, I'm getting some calcium there, but again, for the most part, I'm not consuming dairy. So green leafy vegetables, collard greens, broccoli. Another great source of calcium from dietary sources, fish with the bones, which I do not eat. So like sardines, but I want to mention it's a good source. And so that's one thing. I might need more calcium. I might not be getting enough from the diet because I've been guilty of not measuring how much calcium I'm getting. And that's probably the case with many people. So I had a few experts on the podcast, Kevin Ellis, who's known as a bone coach, and then Margie Bissinger, who's a physical therapist. And I remember Margie saying that you want, I believe, 1,200 milligrams per day. And then if you don't get that through the diet, make up through the supplements. So again, I can't say currently I don't take a calcium supplement. I am getting a bone density scan. I know I'm not a huge fan when it comes to scans, but I decided to get one. My interview with Kevin Ellis, which was a while ago, but he was encouraging even people in their 30s because of his history of having osteoporosis, even though I believe he had celiac disease, and that was a factor. But again, very low, like compared to a CT scan or others. I mean, I'm not really worried too much about the radiation, but I'm interested to see what my bone density looks like. And again, maybe I need, and it's more than just calcium, but I guess the point is, I'm curious. I don't know if I'm consuming 1,200 milligrams of calcium per day, but I am eating a good amount of protein, which also helps not only with muscle mass, but bone density, but then also the weight bearing exercise. So I'm just curious. I'd be shocked if I have osteoporosis, but is it showing any signs of osteopenia? Again, I'll see in the future. Sleep. So that's another area I probably could improve, but just I've always slept pretty good. I mean, there's been some times where for just short, maybe for a few weeks, where I had some sleep issues, like waking up in the middle of the night. But usually I get between 7.5 hours sleep. And usually I'm sleeping through the night, unless if one of our pets wakes us up, or, I mean, there could be, I mean, I'm definitely more of a light sleeper now than I used to be. But again, usually I'm sleeping throughout the night. But again, it's an area where I can probably improve. And when I say 7 to 7.5 hours sleep, that's actually sleep, not the time spent in the bed. So I'll spend, I can't say I fall asleep like 2 minutes upon going in bed. So I'll probably be in bed for about 8 hours, or a little bit less than 8 hours, and sometimes 7.5 hours. And that's when I get closer to 7 or 7 hours and 15 minutes. But from an energy standpoint, I feel pretty good. I don't feel like I'm sleep deprived. I do think some people could get away with less sleep than others. I mean, I don't know if I'm one of those people. I definitely wouldn't push it. Like, I wouldn't try to get away with 5, 6 hours sleep per night, at least not on a regular basis. But yeah, so sleep is something I think with anybody, it's important. And it's a big problem with a lot of people. A lot of my patients, we need to do things to improve sleep duration, sleep quality. Sunlight. So let's talk a little bit about sunlight, another area where I could do better. And usually I'm getting 5 to 15 minutes per day, although I will skip some days. And I have the luxury where most days, even though I do have a physical office, I work from my home office a lot. And so during breaks, I mean, even if I'm working from my regular office, it's not like I can't go outside, but it's easier. I have a deck in my home, and I could just stand out on the deck for a little bit. And yeah, so it's, so like I said, something I've been trying to do more of, and I'm better now than I was in the past, but still could be even better. And speaking of which, I'm not a big fan of suntan lotion. Like, it's not like I never use it. And I forget, my wife, she uses more of a natural brand of suntan lotion, but I rarely use it anyway. Like, I never use it when I'm at home. If we use it, it's like if we're going out of town on vacation and we're going to be out in the sun a lot. And even then, I try to minimize it as much as I can. So, and again, I'm not telling you specifically to do that. Obviously, there's risk with skin cancer and all that, and everybody's different. So I'm careful about not getting burnt. So I'm not saying I'll like lie on the beach for 2 hours. I mean, I'm not a big beach. I like the beach, but I can't say I do that anyway. But like I said, I can't say I never use it, but I definitely make sure to get sun, was the point of bringing this up. So let's move on to toxic load reduction, because we live in a toxic world. And this is an area I think I've been pretty good at compared to a lot of other people. So, I mean, from a diet perspective, I'm trying to eat whole, healthy foods, mostly organic. So trying to minimize the pesticides and glyphosate whenever I can. And then in the home, using mostly, or pretty much, not all natural cleaners and cosmetics, soaps, natural shampoos, natural shaving cream, deodorant, toothpaste, again, household cleaners. So that's, yeah, I mean, I get exposed. Like, if I'm working out at the gym, there's not, like, when people, thankfully the gyms we're using, it doesn't have, people aren't using the sprays anymore like they used to. They're like, I guess there are these wipes, which I'm sure there are chemicals on those wipes, but again, better than people spraying things all around where I was being exposed to that. And but in the home, I don't have that concern. So I'm not going to go over like all the different brands I use, but some people have probably two of the most common questions, like what brands of deodorant is good and what brand of toothpaste do I use that's fluoride free. So toothpaste, I like Dr. Bronner's. I use the spearmint toothpaste, and then Schmidt's charcoal and magnesium deodorants. So I mean, obviously you don't have to use these, but if you use a toothpaste, I do recommend one that's fluoride free. At least that's what I've been using. And then with a deodorant, make sure I get natural, aluminum free. Pots and pans, we use stainless steel, ceramics, some glass as well. So that's we don't use like aluminum pots and pans. And then also I mentioned the water filter, reverse osmosis, and then also have a shower filter. When moving, we've been in our current home for over 8 years now. And I purchased an Aquasana whole house filter, but we had some issues installing it. And so we ended up sending it back, which is it's a pretty big filter for the whole house. So, but we did send it back, and now we just have individual shower filters, also from Aquasana. And so, I mean, if you could do a whole house filter, that's great. If not, shower filters, especially if you're renting, you probably can't do a whole house filter, but you could do a shower filter. And water filter, again, very important. Air purifiers, we have a few Blue Air purifiers in the home, one in the office. So air quality is important. And then also, when it comes to reducing toxic burden, sauna therapy. If you have hyperthyroidism and you have an elevated resting heart rate, I'd be cautious about doing sauna therapy because it does increase the heart rate. But I do sauna therapy now 3 times a week. It used to be twice a week, but I've been pretty good about doing it 3 times a week, unless I'm out of town. Make sure to also, I take electrolytes after going into the sauna. And usually I'm in there for about 30 minutes. I'm not sweating the whole time. It takes a little bit, probably like 10 minutes or so, 10, 12 minutes before I start sweating. And in there a total of 30 minutes. So that's another way I'm reducing my toxic load. Supplements. So I do take some methylation support, which I won't get into here for those who are not familiar with methylation, but I have what's called a MTHFR C677T homozygous genetic variation. And then, so I take that pretty consistently. NAC, sometimes I'll take. I do have my own product called Hepatommune Supreme, which I can't say I take regularly. Same thing with NAC, but sometimes I'll just get a bottle of the Hepatommune Supreme, sometimes just a bottle of the NAC, and just take the bottle and then take a break when I do that. I do also sometimes either a 3-week or an 8-week detox. There's something called the Omni Cleanse, which is an herbal homeopathic detox. So I'll do that usually like once a year. I'll do the Omni Cleanse. I used to do like detoxes like 3 or 4 times a year. Now I might do them like once or twice a year. Maybe do like an 8-week Omni Cleanse and a 3-week. It really depends. But like I said, even in between that, sometimes I'll just get a bottle of Hepatommune Supreme or NAC to support detoxification. Lymphatics, almost forgot to talk about lymphatics. So rebounding, I have a rebounder. And so again, I'm not great about doing about using a rebounder. So rebounder, I'll use honestly a few times a week at them. Sometimes I'm bad about the rebounder, just forget, honestly, even though I shouldn't. That's an excuse because I see it. It's not like it's hidden or anything. So I just don't make the time. There also is, I did an interview with Kelly Kennedy. I do have what's called the Flow Vibe, which is a gizmo, and you could use that for the lymphatics too. And that's really good to use. And then there's other things. I don't do dry brushing, but that's also good for lymphatics. And then finally, let's talk a little bit about EMF reduction. So reducing electronic pollution, electromagnetic fields. So we did get our smart, what is it called? The smart, not smart machine. Anyway, smart meter turned off. My cell phone, I don't carry my cell phone everywhere. When I do have it with me, I mean, unless if I'm using it, I'm usually pretty good about putting it on airplane mode. But most of the time, it's not with me. Like it might be sometimes in the same room with me, but I mean, some people carry it with like they have it in their pocket all the time or right next to them all the time, and that's not the case with me. Again, sometimes it is. I mean, if I need it, usually if I'm, yeah, like I said, it depends on the situation. Unplug the Wi-Fi at night, something I do. Uh, and yeah, just, I mean, again, I could do a better job at night. Usually I'll try to get off at least a half hour before going to bed. I tell people it should be at least an hour, sometimes 2 hours. Again, I don't have sleep issues, but still, it's if you have sleep issues, definitely an hour before going to bed. Stop all electronics. 2 hours would be even better. But I think we all should be doing it, not just if we have sleep issues. Musculoskeletal support, so chiropractic care. I'm my background's a chiropractor. I'm a doctor. I'm still licensed as a doctor of chiropractic, so I get chiropractic care. Sometimes I'll slack off a little bit on the chiropractic care, but I try to go in for at least monthly visits, wellness visits. Same thing with massage therapy. I go to a massage therapist typically like every 5 weeks. The deep tissue massage, not getting relaxation massage. Nothing wrong with relaxation massage, but I'm there getting deep tissue. Oral health. So a lot of people don't relate oral health to thyroid health, but again, oral health is important for overall health. So I mentioned the natural toothpaste that I use. I also brush and floss daily. I do oil pulling a few times per week using coconut oil. Again, minimize sugar for cavities, but also don't want to have blood sugar imbalances as well. I do go to the dentist typically twice per year. I don't get x-rayed every year like some people do. So my dentist who I had on the podcast, Dr. Eric Kempter, he he recommends now every 2 years. And sometimes I'll go longer than that. So hopefully he's not watching this, but usually it's yeah. Anyway, so that's up to you and your dentist. I'm just not a big fan of regular x-rays like every single year. But yeah, that's just my opinion. So let's talk about supplements because I know a lot of people want to know what supplements I'm taking, and I know that because I listen to other podcasts and watch other videos with other health experts, and people always want to know what supplements they take. And I will say this: I probably take more supplements than I need to take. I do like supplements, and so not everything I take, I'm saying that you have to take on a wellness basis. That probably isn't the case. And usually when someone is in remission, I usually do talk to them about minimizing the supplements. I mean, I might tell them what I'm taking, but usually just if they're taking like 3 to 5 supplements on a wellness basis, great. Again, I take more than that, but that's my choice. So probiotics, I've been taking probiotics for a long time, and I rotate probiotics. I take a lactobacillus bifidobacteria probiotic regularly. I do have my own product probiotic, SMT-Probio. That's one of the ones I take and rotate. Some will ask about spore-based probiotics. I don't have my own spore-based probiotic, at least not yet. But I take one. I take one once or twice a week just to play it safe. The research definitely there's more research on those that are lactobacillus bifidobacteria based. Prebiotics I've been taking since about 2018. So I can't say I've been taking prebiotics since being in remission. And I just add certified organic prebiotics to my smoothie. And that's how I get my prebiotics. And fish oil, a fish oil supplement. Again, I don't eat a lot of fish. So I take fish oil, and I recommend on a wellness basis to try to get at least 1,000 milligrams of EPA, 500 milligrams of DHA if you can. And so different fish oils have different amounts of EPA, DHA. Now, if you're eating fish 3 or 4 times a week, again, you might not need to take that amount. You could always do a blood test such as a fatty acid profile or omega-3 index. There is a company, omegaquant.com, where you can order that, at least if you're in the United States. Vitamin D, I do take vitamin D with K2 just because, again, even if I got enough sun, for those who get enough sun, sometimes you still need to supplement with vitamin D. But again, I'm getting better in that area, but I'm still not perfect. And I take magnesium. Typically, magnesium glycinate is what I take. Some people like magnesium threonate because it to affect the brain. The blood passes the blood-brain barrier, but I take magnesium glycinate. Zinc, I don't take zinc every day, but sometimes I'll take zinc glycinate as well. Garlic, I do take garlic pretty much every day to help support circulation. It's also great, great antimicrobial. CoQ10, coenzyme Q10. I take a coenzyme Q10 supplement every other day, about I think it's 100 milligrams every other day. Methylation. So I take a methylation supplements. However, I used to take it every day. More recently, I was listening to an audiobook by Dr. Kara Fitzgerald. I think it's called Younger You. And she was talking about how you don't want to over methylate, that could actually increase risk of certain types of cancers, which scared me. So I take methylation support because my homocysteine was elevated. And also, by the way, she said if you take it for like greater than, I think it's like 6 years. So if you just been taking it for a few months, not a big deal. But I've been taking methylation support for a long time, not since being diagnosed with Graves, but a number of years later, I tested my homocysteine that was elevated, learn about methylation, which is a type of phase 2 detoxification. But ever since listening to her book, which is not too long ago, I started taking it every other day and going to try to see what I could do through the diet. I feel like I'm getting enough through the diet, but that hasn't been enough to keep my homocysteine at healthy levels. But she talks about that a lot of her book focuses on getting enough of the nutrients through the diet. So yeah, so again, something I will work on. But if you're listening to this and if you happen to be a patient, if I recommended a methylation supplement, again, what she says at some, I forgot when, but she was like saying the research shows like if you've been taking it for a long, like if you're over methylated for a long time, just because you're taking a supplement doesn't mean that you're over methylated. And there's not like a great test. There's some tests like Dutch tests that looks at methylation, but yeah. Anyway, just wanted to bring that up. Multivitamin. A lot of people ask about a multivitamin. I take a multivitamin, but not every day and not the full dose. So I don't, maybe I do need to take the full dose. Maybe I don't need it at all. But so I do take a multivitamin at a reduced dose. Creatine monohydrate, also for muscle, what I take for muscle mass, I'll take 5 grams, I believe. And it's a powder that I add also to my smoothie. So those are some of the ones I feel more strongly about, but then there are others that I'll take that I feel less strongly about, and I'll rotate. Like vitamin A, I'll take maybe like once or twice a week. Detox supplements I mentioned, again, NAC, Hepatommune Supreme. Again, it's not like I take those continuously throughout the year. Now, nanokinase I do take pretty regularly to help like with prevent blood clots and all that. It's also good for inflammation. You want to take it away from food. So I do take that regularly, but same thing. I take cayenne pepper most days, cardiovascular support. So maybe I do feel more strongly about these, but it was just why I take them regularly. But yeah, so maybe I should have mentioned them earlier. An organ complex supplement. Again, I don't know if everybody really needs that. If you're eating organ meats, you don't need that, but I don't eat organ meats really. So I take an organ complex supplement, sometimes alpha lipoic acid, again, not regularly. I do take an eye support supplement, but I rotate. I don't take it every single day, maybe like 3 days a week. I take an eye support supplement. And then many of you know I had chronic Lyme disease. Once you have Lyme, it doesn't really leave. It's kind of like Epstein-Barr. So there is a supplement from Green Dragon Botanicals called LB Core Protocol, which I don't take every single day. I take 3 capsules. I think the serving is like 9 capsules, but that's if you have active Lyme. They had a wellness supplement, but I don't think they sell it anymore. So I just take 3 capsules every now and then, maybe a few times a week. And then speak of Lyme, I guess, so I'm pretty much done with the supplements, but as far as some scares like that I've had over the years, since maintaining a state of wellness, like so a question you might have, was there ever a concern that I might relapse? So 2016, I had shingles, which is a virus, and that was an instance when I thought maybe I would relapse, but everything was fine. But then 2018, the summer 2018 is when I was diagnosed with chronic Lyme, and that I was terrified that I would relapse. And again, thankfully I didn't, and I feel really good. I don't feel like I have Lyme. Even then, it was more neurological symptoms, but that seems to be in check. And then in January of 2022, I had COVID pneumonia, and then I also thought I relapsed because in this case I was having tachycardia, elevated resting heart rate, but that's not uncommon with COVID. And I did a thyroid panel about a month after. Everything looked good at that point, including antibodies. I did have high CRP, C-reactive protein, so I still had a lot of inflammation after that first month, and then a few months later retested CRP and it was still really high. So, and then tested it like 3 months later and finally it normalized. So the CRP was out of range for a while, but the thyroid thankfully was stable. And then I also wanted to mention things that I don't currently do, but might consider in the future. So I have a red light therapy unit, but I don't use it. So I actually want it. Actually, I had one that I purchased years ago, and then my wife misplaced it. I don't know how she misplaced it because it wasn't a full body one, but it was a half body one, and she was cleaning the home, and I think maybe she just didn't want it out. So I have no idea what a red light therapy unit is. But then I won one a few years later, and it's in the office. And again, I spend most of my time at home. I put it in the office just because a few reasons. One, my staff person, Kate, at the time was working there, and now she moved. She's actually, won't get, anyway, so she's not in the office most of the time, but figured she would use it. And then I figured if I had kept it in the home, again, my wife might move it again. So I do have it. I just don't use it. Coffee enemas or colon hydrotherapy, things I haven't done. And but again, I know they have some good benefits. So again, maybe in the future, I'm not sure I mean, not that I mean, the thing with coffee enemas, I've done enemas in the past, not a lot, but I've done them. So it's not the enema, but preparing the coffee. Colon hydrotherapy, one of these days I'll probably give a try. Cryotherapy, ice baths. I don't do that. I do take cold showers, but I don't do ice baths. Again, don't know if I'll at least purchase an ice bath if someone has it and I'm over their home, and if that's the reason why I'm there, maybe. But acupuncture. So acupuncture, I used to get acupuncture in the past, just not regularly, like for years, but I got a series of acupuncture treatments, and it was fine. But again, I don't know if it's something I would get on a regular basis. Not that there's anything wrong. It's just a time thing also. It's like I only have so many hours, just like we all do. And I do a lot to take care of my health, but I also do a lot for the practice as well. Besides seeing patients, do a lot for the podcast, putting together videos. I mean, again, so it's just a matter of trying to prioritize. And so right now I haven't put acupuncture as a priority. And then finally, I wanted to answer the question, what would I do if I relapsed? Again, I've been in remission for about 15 years, which I'm grateful for. But again, there's always a chance I could relapse. And if I relapsed, I will say that I wouldn't have any regrets, and I would take a similar approach as I did in 2008 into 2009. I will continue to focus on diet and lifestyle. Again, I would try to improve the areas like maybe more in stress management. I think I'm doing a good job, but again, I probably could do even better. Again, I said sleep. I mean, there were other areas. So again, I can't say I would do things a lot different. There would definitely be a lot of similarities. And so that's pretty much all I wanted to cover here. But before wrapping this up, I want to ask you what's the number one reason why you want to restore your health? Perhaps it's just so you can feel good again, or maybe you're unable to do some of the things you used to do because of your health condition. But either way, please let me know in the comments below. And if you want to learn more about how to save your thyroid and regain your health, then I highly recommend to watch one of my free webinars related to thyroid health, as I have one related to hyperthyroidism and Graves' disease, and another one related to hypothyroidism and Hashimoto's. and you can access them by visiting savemythyroid.com/thyroid webinars. And you can also find a link below in the description. Thank you so much for joining me today. Please give this video a like if you found it to be valuable, and consider subscribing if you want to learn more about how to save your thyroid.